Hi, I'm Emma Sutherland, clinical naturopath, author, mum, and your host. With over 20 years in clinical practice, I've helped thousands of women and families transform their health using evidence based integrative strategies. I am deeply passionate about making science simple and actionable so you feel confident and empowered in your health decisions. This channel is your go to for trusted insights, expert interviews, and practical tools that support real life wellness. Today, I'm very excited to be joined by accredited nutritionist Sonya Reynolds to explore a really important topic for families navigating pediatric epilepsy, which is the role of dietary therapy in seizure management. Specifically, we'll be diving into the ketogenic diet and the modified Atkins diet, which are two popular evidence based interventions that continue to gain traction for their potential to reduce seizure frequency in children with drug resistant epilepsy. Now, many of you watching this may have already done significant research and may even be trialing these diets yourselves. Our goal today is to go beyond the basics and ask the nuanced questions that matter around effectiveness, long term sustainability, safety, and quality of life. Sonia brings both clinical experience and personal experience to this space, and I am excited to learn from her insights. Hi, Sonia. Thank you so much for being with us today. I really appreciate your time.
So happy to be here with you, Em.
Now, before we kick off with the research today, can you tell us a bit about your personal experience with epilepsy?
My daughter was born neurotypical nearly 17 years ago now. And at the age of 3, she suddenly started having epileptic events. We didn't know they were epilepsy, but her eyes were rolling into the back of her head, and then she would talk to you again, and then
Okay.
she'd go to rolling. It was incredibly distressing and scary. There's multiple seizure types, not just a tonic-clonic. Unfortunately, she had many different types of seizures. She had what's called refractory epilepsy, so she failed 3 or more medicines. When your child or someone in your life, you're so worried for their well-being and genuinely their life when their seizures are so severe, you'll do whatever it takes. It wasn't that long ago that the internet was still quite the Wild West. You still couldn't find information easily. And so I really advocated and pushed for a ketogenic diet with our hospital, and we saw a 50% reduction in seizures. So phenomenal. When you weren't getting really any reduction in seizures, to have a 50% reduction is phenomenal. And then also, we went through that journey of going from keto to modified Atkins, and we'll talk about the research. And now, where we're at is that they're saying she's no longer epileptic, which is pretty
Oh,
phenomenal. That's just very recent history. However, there's questions around she's having events, and we don't quite understand what they are, but she was previously diagnosed with epilepsy. So we're still understanding and on a journey of conventional medicine alongside holistic and alternative therapies.
I think this is why I really wanted to interview you is your experience as a nutritionist and your personal experience of having lived with, a family with epilepsy is why you are such a great person to speak on this topic. So let's hit the research because you and I both love our research. A 2020 study looked at 158 children with epilepsy that didn't respond to medication, like your daughter. It compared three diets, the classic keto, the modified Atkins, and the low glycemic index therapy. After 24 weeks, all three diets did help reduce seizures. However, the modified Atkins and low glycemic diets didn't match the classic keto and how well they worked overall. How do you interpret those findings in clinical practice, especially when you're working with families and you're discussing diet options?
First of all, I hear that research, and that's so good that 150 families went through this. I love hearing that research and thinking about it. I prefer progress over perfection. Like, I think if people go, well, the only thing that I can do is a classical keto, that's really hard because it's more than 50% fat. Sometimes 90% of a child's diet would be a ketogenic diet. If that stops someone from making a change, then I would say to them, even though the research shows that you can get better results with a classical ketogenic diet, if it means that you can only start with the modified Atkins and the low glycemic index, then that is a perfect place to start. And then
Mhm.
maybe what you do is, rather than going from keto to MAD, which is a lot of what a lot of people do. So modified Atkins, I'm going to call MAD just for
Yeah.
my own shorthand. You know, our experience was going from the really hard keto diet to MAD, because the thing about it is, if you're eating a substantial amount of fat, it can be hard for our very, sad Australian diet to get our head around fats as being good. It's a big jump, is what I'm trying to say. So, someone like a nutritionist or a naturopath, we've still got to rethink how we're going to feed our children. So, number one thing, yes, the evidence is better for the keto diet, but if it means you're going to try it, then don't even worry about it. Do MAD or low glycemic index eating. And then I think the thing is that with keto, because it is more strict and you're really using that fat metabolism, that ketone production. And so therefore it's really anti-inflammatory. I would love to know the exact diet they were using, in the sense of, you and I will know, there's so many ways you can optimize a ketogenic diet or a modified Atkins diet or a low glycemic diet to get better results. For example, a really high quality medium chain triglyceride. So were those children given extra MCTs? What was the fat that what they were using? Like, I'd want to just really get in there and put our lens on it as well.
And what are patient specific factors when you're deciding whether you're going to recommend keto or the modified Atkins? The age of the child, the seizure type, or the medications involved. What are your criteria on that front?
Number one, so when we're thinking about that, kids are usually quite resilient to this diet, unless they've got clear gallbladder type issues with how they're metabolizing fat. Also thinking about their enzymatic capacity, how we break down fat is with enzymes as well. So thinking about how they're breaking down their fat and how they're assimilating it would be part of the reasoning of how I would support them on that diet. But there really isn't a lot of reasons why I wouldn't use it with a child. And to be frank, with an adult either, because we know that we can manage cholesterol. And quite frankly, it's usually their carbohydrate intake that impacts their cholesterol more than their fat intake. So I really think you should work with the prachy, because we understand the metabolism of fat. We know about how you're going to assimilate and absorb it. Other than that, I think it's a really good, safe intervention. Remembering that, look, there isn't this huge amount of research around kids and a lack of carbohydrates. But I think that's because we are just so sad. We're all just on these sad diets with these huge amount of carbohydrates. So I just think, as research changes, I feel really safe using it, to be honest.
Mhm. Mhm. And look, the literature reviews, the practice guidelines, they, a lot of them do highlight the side effects of keto. I think there was kidney stones or gallstones in one paper that I read, and, they stress the importance of monitoring. But for you, when you're working with families, what are the most crucial safety concerns you monitor or keep an eye on? And how do you proactively manage that?
So if a child is on a classical keto diet, that is out of our scope, that needs to be in a hospital. They will be managed with blood tests and check for bone density and questions around growth. So remembering, as I said, carbohydrates equals growth. So therefore, following that sort of pattern. With the whole kidney stones picture as well, I think that what I'm seeing is, I'm not seeing it in
Okay.
clinical practice. I think that's around what type of carbohydrates, what type of fats, and what type of proteins they're seeing. But I really don't see that's translated in a pediatric population.
And when you say hospital setting for keto, what kind of macros are we talking about there? Let's clarify the macros for both of those.
Yeah, you can do a modified Atkins diet within the hospital setting also. Both those diets are available. Depending on how severe the seizures are, they may say go to keto first and then try MAD, or they'll say try MAD and titrate up. You can go either way within the hospital setting, but fundamentally, they're managed by a team of dietitians, making sure you don't want them to also go too low carbohydrate and have issues with and having seizures just from the low amount of carbohydrate. It is a very serious diet, but there are simple changes that parents could be using at home. I really believe that the low glycemic index style of eating should be the first place that a child should be prescribed a first treatment stage, because you can see so many differences just with taking out colors and flavors and Franken type foods.
I would 100% agree. I don't work with kids with epilepsy. I work with a whole heap of other kids, but we see profound changes when kids go from a very standard Australian diet to a clean whole foods diet. It's true. So I think that's a great reminder that, you don't have to get it perfect. Just make that first step is always a really good point. And, I was reading a 2023 paper on parental stress, and it showed that caregiver support significantly impacts that ability to adhere to a diet. So what sort of structured support do you find most effective in reducing stress for the caregivers of kids with epilepsy?
The number one thing that I find is that overwhelm, that
Oh,
perfectionism. Like, it's my fault. I've got to fix them. And I totally relate to that
yeah.
as well. So, number one, I try and give them as many resources or ask them, what do you need? So,
Mhm.
someone might be like, you know what, I've got dinners covered. I can get that, high protein, lots of veg, just troubleshooting how they can change their existing diet. So, giving them those resources, giving them those support, and just really fine tuning what they're eating, because sometimes you don't have to throw out exactly what you're eating, right?
Yeah.
Tweaking and optimizing and having those conversations around, okay, so you can't have this carbohydrate, but what about talking about an alternative? And we didn't talk about this, but it falls within dietary changes as well. And we know that these kids are more likely to have issues with dairy or more likely to have issues with gluten. Just be really aware of that. And I wonder if sometimes they're seeing the benefits of taking them out, and that's where half the benefits come in, because we know the gut and the brain
Mm.
communicate with it. So
Yeah.
those sort of very specific, like targeted, personalized support. I also do meal planners, and I think the biggest mental load is just thinking of ideas for food and how to do that.
Yeah. And these families have more than one child a lot of the time. So it's about the family food and how the logistics on how to integrate a diet therapy in amongst a family setting. And I think that's where people really do need to be seeing somebody like you that has good experience in this space and walks the talk, knows what it's like to try and put dinner on the table at 6 o'clock every night. And school lunch boxes, get them sorted, and all of that logistics can be a
And it
nightmare.
is. And getting the buy-in from their
Yeah.
greater community. For example, going to school and saying, my child's on this diet. If you have a party, can I bring my own cake? I guess there's a shame. Like, I'm just thinking out loud, a bit of
Yeah.
shame and like, oh my gosh, I don't want to make my child different. I find when you are really honest and people know it's a medical style of eating, they're really open. It's like someone that's a celiac. You're not going to turn
That's
around and
right.
go, "Sorry, I'm not going to give gluten-free options." If you communicate that, I find people really want to help you and support you. For me, I had someone support me while I was on the really strict keto diet. But that was probably the best thing that happened to me, is just have someone there batch cooking a whole bunch of dinners, a whole bunch of lunches. so that it took that mental load out as well. And so just those classic things that we do to reduce our mental load in general as mums, being really strategic and firm and asking for help, telling people, it's not a failure to ask for help, isn't it?
No, not at all. And I think one of the other things that, is really helpful about working with somebody, during this phase is just working out what to prioritize out of all the things you feel like you need to prioritize. It's just having a sounding board and some accountability of somebody that can say, look, focus on one, two, three, everything else can wait, can be absolutely groundbreaking for a lot of parents, which I think is important to acknowledge.
Yes. I was just going to say, I mentioned MCT oil. So, strategic therapeutic supplements, when appropriate, can really support that keto lifestyle too. For example, making breakfast like it's a therapeutic ketogenic smoothie just takes planning, adding MCT oil, or perhaps there's some carnitine. I can really support parents because there's so many supplements out there, as we know. So just knowing that what I'm giving or what you're receiving from a practitioner is going to actually have a benefit to your child.
So that being said, do you think that earlier diet initiation or specific epilepsy types can predict better outcomes? Are there any clinical insights or demographic markers that help you predict, I think this child's going to benefit from doing keto initially, or this child, I think they're going to benefit from doing modified Atkins. Is there some delineations you can outline at all?
I love that you said that. There's some really good evidence around more severe seizure types like Dravet. So there's really good evidence for that diet therapy reducing the seizures. And that's a severe seizure type. The parents have done a bit of Googling anyway, and they're coming to you saying, can you support me? Without a question, a severe seizure type, I would be using diet therapy because usually what happens is they're getting so many side effects from the medications that they're just at that sort of breaking point because they've got all these side effects like mood, anger, sleeplessness, weight loss, weight gain, that they're just really looking for something that they can implement and feel like they're having an influence. I'm very pro the diet. And really, the caveat is the family prepared or able to? Sometimes you don't have the energy, right? So really, my only real caveat is this family prepared to do this? That's why I say to you, doing low glycemic is still fantastic because maybe that's all the family can take on at this stage.
Let's talk about expectations because while many randomized controlled trials focus on seizure reduction of about 50%, which is what your experience was, parents often want to see full remission. Part A, the question is, do you think that's a reasonable treatment goal? And then B, how do you counsel parents on expectations with dietary interventions?
So we're thinking in statistics and we're saying on average, someone reduces their seizures by 50%. But what if you're outside of that and you're the full reduction in seizures? You don't know until you try it. So I think managing expectations is give it a go. What have you got to lose? There's so many side effects. You can do it while you're still on the medication. So it doesn't have to be one or the other. So even if reduce it by 30%, and that means that you're not fearful of your child having a seizure in their sleep or worried about you being out and about and them having a seizure in the middle of the road. Even if it reduces that much, I think it's valid changes. So I just say, what do you have to lose? And the fact is, you can do it when you're on medication as well. So for me, that's a win win. Generally, what I'll see is people weaning the medication. They haven't done my keto and they haven't done it with strategic things like MCT oil, for example. I just say, I believe with really holistic ways of treating the child's diet and looking at maybe there's an allergy or a dairy or something that they shouldn't be having. That's where you kind of get that goal.
Well, we've talked about a lot. We can always talk about so much. My next question for you is, are there any myths that you want to bust for us around epilepsy, or just last thoughts for us?
Something that I feel like I have really learned about since my child's diagnosis is how multifaceted epilepsy is. Diet therapy is amazing and really helpful, but I also want to talk about exposure and what was the trigger and thinking about that pandas. So when you say to me as well, there's 50% reduction on average, I always think about, well, what else is triggering this brain to wanting to clean itself? So,
Yeah.
really, epilepsy as a symptom and what is the cause of that without placing blame on anyone. Let's be really clear about that. But looking for what's the underlying factors. The myth busting that I have is I see a lot of heavy metals, I
Yep.
see a lot of gut issues and mycotoxins. So, could be all of it, could be none of it, but keeping this really open mind when we're treating epilepsy that yes, diet therapy helps and it will reduce inflammation, no question. But if you're not addressing the cause or not looking deeper, then the diet's only going to go so far.
Yeah, a lovely reminder of that holistic nature of the work that we do, that, it's always multifaceted and we need to think outside the box in every single case. That was a great way to finish. Thanks, Sonia. So, where can people find you? We will put links in the show notes, but let us know where people can find you.
You can find me at Sonya with a Y, sonyareynolds.com.au. I'd love to support anyone in your community. Thanks, Em.
No problems. Thanks for your time today, Sonia. Thanks so much for being with me today. Don't forget to like this video and hit the subscribe button below. Feel free to check out the links in the show notes for more health empowering information. Don't forget, you can ask me any questions in the comments below.